Hi everyone, so today we're gonna talk about one of the fluid and hemodynamic disorders, which is shock. So, what is shock? So, shock is a life-threatening condition of circulatory failure causing inadequate oxygen delivery to meet cellular metabolic needs and oxygen consumption requirements, producing cellular and tissue hypoxia. Normal tissue perfusion requires a functioning pump, intact pipes, and adequate fluid, but in shock there is an inadequate perfusion to tissue. So as you can see on the picture, causes of shock include severe allergic reaction, significant blood loss, heart failure, blood infections, dehydration, poisoning, and burns. On the left side, you can see the effects on the body given by shock. It gives effects of drowsiness, irritability, anxiety, fainting in our head and in our eyes. It gives enlarged pupils. It gives an effect of fast pulse in our heart, shallow and rapid breathing for our lungs, excessive sweating in our armpits, nausea or vomiting, blue or gray fingernails or lips, and cold, pale, or clammy skin. To remember the different types of shocks, we can use the acronym SHOCKS. S for septic shock, H for hypovolemic, O obstructive, C cardiogenic, K anaphylactic, and S spinal or neurogenic shock. Septic shock is a severe and potentially fatal condition that occurs when sepsis leads to life-threatening low blood pressure. So sepsis is a life-threatening condition caused by the body's response to an infection. Hypovolemic shock is a life-threatening condition that results when you lose more than 20% of your body's blood or fluid supply. This can also lead to organ failure. So obstructive shock is a form of shock associated with physical obstruction of the great vessels or the heart itself. So pulmonary embolism and cardiac tamponade are considered forms of obstructive shock. Obstructive shock is commonly grouped together with cardiogenic shock, which is a serious condition that occurs when your heart cannot pump enough blood and oxygen to the brain, kidneys, and other vital organs. It is a medical emergency and should be treated immediately. Next is the anaphylactic shock, which is a rare but severe allergic reaction that can be deadly if you don't treat it right away. So it's most often caused by an allergy to food, insect bites, or certain medication. A shot of a drug called epinephrine is needed immediately, and you should call 911 for emergency medical help. Lastly, we have the spinal or the neurogenic shock, which refers to a clinical syndrome characterized by the loss of reflex, motor, and sensory function below the level of a spinal cord injury. In some instances, this syndrome is associated with loss of autonomic tone leading to hypotension, hypothermia, and ileus. Ileus is a temporary arrest of intestinal peristalsis. So here in the table, we have a comparison of the different types of shock. So for the guides, we have decreased CO, meaning decreased cardiac output, which is a medical condition that occurs when the heart does not pump enough blood to meet the needs of the body. Systemic vascular resistance is the resistance in the circulatory system that is used to create blood pressure, flow of blood, and is also a component of cardiac function. So now I hope you understand the third row, which contains the decreased CO, increased SVR of the different types of shock. So for our next table, we also have a more detailed examples and definition of the different types of shock so that you can understand it well, and it is also simplified. So thank you for watching, guys. Bye!